it's the assumptions people make, I think, that are also barriers to collaboration and communication. Before sort of labeling someone a problem family, to think about all of the possible contexts of where they came from that day. It could have absolutely nothing to do with, and probably has nothing to do with, their medical condition or anything else. You know, if you're having a bad day, you're having a bad day. One family I remember that we became really good friends with, and before I had met them, their youngest of their 4 children was born quite critically ill. Before I had met them, I had heard about them. And the staff in ICU, you know, were terrified of these parents because they were both lawyers, which was bad right there. So that was their context, right? Lawyers. And that was sort of where the label began and ended. And I just, by the time I met these people, I was sure that they must have horns. And, you know, of course, then having met them, now they're some of the best friends we made in the hospital. These were just people who had 3 other children at home who they were trying to figure out what to, you know, child care issues and how to get them to school, how to deal with these 3 other kids and all of their fears and not understanding why their baby sister was in the hospital where they weren't actually allowed to visit her at that time. She was on palliative care probably 3 or 4 times in the first sort of 6 or 8 months of her life. And they would bring their other children in to basically say goodbye to the baby, and then, you know, and then she would rally. And it was awful. There was so much going on in their lives. And the grandmother got diagnosed with cancer in the midst of all of that. And so all of that, without knowing all of that, you would think, boy, these people are really, you know, angry, grumpy people. It's like, yeah, they have really a lot of reason to be angry, grumpy people. If you have a time to have a 5-minute conversation, you would understand some of the context of where people are coming from. And, you know, allow for the fact that people have lives outside of whatever is the small box that you're seeing them in. I remember one mother saying, she overheard some healthcare workers talking, and one said, you know, oh, this mother is so angry all the time. And the other person saying, well, you know, she wasn't angry before she got here. So, you know, that sort of idea that, you know, we're not at our best. Before Quinn got his trach, and we were in the nursery, and I was so tired of him having an endotracheal tube up his nose and 4 pounds of tape across his face. And, you know, it was so restrictive for a baby. His neck was actually turned to one side because he, you know, had just pounds of tubing coming out of his head all the time. And there had been talk about tracheing him and this and that, and lots of discussion going on without me being involved in it. And then I saw some other babies in the nursery at the same time who got trachs. And I saw what an enormous difference it made to them developmentally. And he was about 4 months old at this point. And I remember thinking, like, I want a trach, and I want it now, because I don't want, you know, I don't want him to be delayed developmentally because he has all these tubes. And I was finally so frustrated, I took a couple of the doctors into a room, and I just said some very unladylike words. And so, I know, I was just, this has to get done. And, you know, miracle of miracles, the next day, his trach surgery was being scheduled. And I just thought, it makes me angry that you made me be that person. You made me be a person I don't like, that I normally am not, in order to get, you know, this thing done. I wished it hadn't gotten to that point. Because that's not the way and again, like the fear of being, then am I going to be labeled as, oh, you know, don't cross her, because she can be really scary. Yeah, I hear people talk about how they're afraid at times to confront healthcare professionals because they're afraid of the that there'd be some sort of retribution in terms of the care their child might get or their family member might get. There's just so many barriers that keep people from really saying what they need to say. So I think I'm not sure what the solution to that is, but to make people somehow feel safe to advocate for their family members is really important.